We all eat for comfort sometimes. A slice of cake after a bad day, a bag of chips during a movie. But for some, eating becomes more than comfort. It becomes a coping tool, and eventually, a prison. This is binge eating disorder, the most common eating disorder in the world, yet often the most misunderstood. It's not about greed. It's not about lack of willpower. It's about pain and the way food is used to quiet it. What is binge eating disorder? Binge eating disorder, or BED, is recurrent episodes of eating large amounts of food in a short period of time, often to the point of physical discomfort, paired with feelings of loss of control. It's different from simply overeating. With BED, the episodes happen regularly and are often followed by guilt, shame, emotional distress. Unlike bulimia, there's no purging after. The food stays, and so do the feeling, what it feels like from the inside. A binge isn't always about hunger, it's often about escape. It might feel like a switch flipping. I just need to eat, being on autopilot, eating fast, barely tasting, chasing comfort in each bite, feeling relief in the moment, and crushing regret afterward. Food becomes a shield, protecting you from pain, boredom, stress, loneliness, but the relief is temporary and the cycle comes back harder. Why it happens, emotional roots. Binge eating often starts as a way to cope with chronic stress, anxiety or depression, trauma or abuse, low self-esteem, loneliness or isolation. For some, dieting or restrictive eating triggers it. The deprivation leads to loss of control. For others, it's a learned behavior from childhood, using food as comfort during hard times. Over time, the brain associates eating with emotional relief, and breaking that link becomes incredibly hard. Signs you might be struggling. You might have BED if you eat unusually large amounts of food in secret, eat quickly even when not hungry, keep eating despite feeling uncomfortably full, feel ashamed and hide evidence of eating, constantly think about the next meal or snack, use food as the main way to handle stress or emotions. These signs aren't about being bad or weak, they're signals that you deserve support. The health impact BED isn't just emotional, it affects physical health too. Weight fluctuations or obesity, high blood pressure, diabetes risk, digestive issues, joint pain, sleep problems, and because shame keeps people silent, it often goes undiagnosed for years. Breaking the cycle, recovery from BED isn't about just eating less, it's about healing the relationship with food and with yourself. Treatment can include therapy, especially cognitive behavioral therapy, CBT, or dialectical behavior therapy, DBT, nutritional counseling, learning balance, non-restrictive eating patterns, medication, in some cases, to manage cravings, or coexisting depression, anxiety support groups, sharing your journey with people who understand. It's about replacing food as your only coping tool with healthier, lasting strategies. How to support someone with BED. If someone you know is struggling, don't shame or comment on their weight. Avoid just eat less advice. It's not that simple. Offer to listen without judgment. Encourage professional help. Be patient. Recovery takes time. Binge eating disorder is not a failure of discipline. It's a sign of emotional pain being managed the only way a person knows how. If this is you, you are not weak. You are not alone. And you are not beyond help. Food may have been your coping tool, but it doesn't have to be your prison. With support, you can rebuild your relationship with eating and with yourself. And that's a journey worth taking.